My name is Lisa. Hi, my name is Gary Lynn, and we are doing nasotracheal suctioning.
To NT suction a patient, there's several steps that you have to follow. The first step is to assess the patient for indication of suctioning. One indication would be that the patient is unable to clear the secretions on his own, audible evidence of secretions in the large airways, and also to obtain a sputum sample.
Okay, stop.
With NT suctioning, there are several contraindications that we need to be aware of when we see that a patient needs to be suctioned. Some of those may include occluded nasal passages, nasal bleeding, acute head, facial, or neck injuries, bleeding disorders, laryngospasm, irritable airways, and upper respiratory tract infections, such as croup and epiglottis.
The second step would be to assemble and check equipment. When you suction a patient, you're given a suction kit, which includes a suction catheter with a thumb port, sterile gloves, and a basin for the sterile water or saline. A gown and mask is required, but goggles are optional. Lube is necessary for the catheter, as well as an oxygen delivery system, which is our non-rebreather. The first step to NT suctioning would be to wash your hands and then put gloves on. After that, we pre-oxygenate our patient. So we're using a non-rebreather. Afterwards, we're going to start to get our kit out. On top of wearing our gloves, we're going to put sterile gloves on using a sterile technique. Now we're going to open our basin, which is what we will use to put sterile water or saline in. And next, our catheter. Nothing. You just switched.
Clean hand, dirty hand.
So now we just connected our catheter with our suctioning source, and we're going to turn it on. The tip of the catheter is applied with lubricant to assure that it'll go in smoothly. Afterwards, we'll just do that. So now that our patient is oxygenated, Gary Lynn is going to insert the catheter inside the patient's nose using a twisting motion. The catheter will go in as far as possible until the RT reaches resistance. Once resistance is met, you pull out a couple centimeters, and then the RT will apply suction and twist the catheter out, sucking as much secretions as possible. Clear catheter with saline after complete removal. And we will assess and monitor our patient to see whether they need to be suctioned again or that improvement is met. If any adverse responses occur, that the patient should be oxygenated and the procedure should be stopped.